The asbestos issue is not a thing of the past. It continues to this day.
We want to end this man-made disaster.
So let's ban asbestos. Well, what a great honor to have the Surgeon General of the United States with us today. The fact is, he's an old friend and colleague and used to work with me where I worked at the National Institute for Occupational Safety and Health. We all have to start somewhere, I guess. But the Admiral is a true hero for public health. He actually practices what he preaches. And oftentimes that's a rare commodity. But Admiral Lushniak is a true promoter of public health, as you will see when he speaks to you. We've had an opportunity to speak with him privately before this meeting, and I get the impression that he's very excited about talking to you about asbestos, but more important, he's excited to talk about public health and what we can do for the next generation and this generation to promote public health, not just in the United States, which is his patient, because he is our country's doctor, but the message he will give resonates around the world. And I'm not going to take a lot of time because you hear too much from me at this meeting anyhow. So I want you to hear from my friend and the nation's doctor, Admiral Lushniak.
Thank you so much, Dick. And I keep saying that Lieutenant Chica, who's so important to the functioning of our office, knows that I have a terrible allergy, and that allergy is to podiums. As a part of my training is in dermatology, and so you don't want to see the hives, just the terrible condition. But anyhow, thank you so much, first of all, for inviting me here to this important event in Washington, and to Linda and to the whole group at ADAO, accolades to you and your activism. And in fact, we'll go through a few slides, but Dick gave me the prerogative of saying, you don't have to stick with the slides. And in fact, I hate doing the slides thing, right? What I want to instill in you is why this is important, right? Why and what the role of public health is in the midst of all this. So first and foremost, I am honored and humbled to be the acting Surgeon General of the United States. A position that I've been able to some extent take on with a resignation of a Surgeon General, but it came beforehand with about 3 years of being the Deputy Surgeon General. And so I realize at this point what an important role. And the reality is I'm at a stage in my career, you can see that, what's interesting about being in uniform is what? Is that we kind of wear our CVs on our chest. Right? Look at all these things, right? It must mean that this guy's important, right? Oh, look at the stripes. Oh, there's something to it. But you know what? I am so relieved to tell you I've gotten to a stage in my career where the ego thing is no longer there. I truly am honored and humbled to be in this position and realize that the position of Surgeon General, albeit in this case with an adjective in front of it that says acting, which means what? Which means I'm the career guy, right? Who steps in to carry the torch until we get to the political. And while I'm here, I am feeling the good vibes. I'm feeling that ability to touch the people we touch, to be able to get a public health message out to those people, to be able to be listened to, because Boris Lushniak, the name, doesn't really mean anything, right? Boris, strange name. Lushniak, strange name. People don't remember that. But what we're empowered with is that the title Surgeon General still makes a difference. Still makes a difference. And people do listen. We saw this recently as we were going through the 50th anniversary of Surgeon General Luther Terry's report on smoking. And what happened with that report was 50 years ago, the world changed. And I realize we're being webcast, and I'm sorry that you're going to be doing some work up there. Is that okay? You're okay, that's fine, okay. It's always the videographers that go nuts, because I can't, yeah, I'm over here now. I'm over here now. But when we issued that report, and I was describing both to Linda and to Dick earlier today, was that what was overwhelming for me was the fact that the press picked up on this. The concept that the Surgeon General said something was important. It wasn't Boris Lushniak, the individual. As I say, it's not the ego thing. It's the idea that empowered in this title, whether we call it the nation's doctor, whether we call it the bully pulpit, is the ability to get a message out. And I'm here to tell you that as signified by the message we put out this week on asbestos, that what you are working on, whether you're a researcher, an activist, a scientist, an industrial hygienist, a regulator, what you are working on is an important public health mission. When I go through the issue or the concept of what public health is about, and let me put in a few slides, is first of all, I have no relevant financial interest, no off-label discussion, work is supported by the US government. I've basically been in this uniform for over a quarter century, proud to serve my nation. On the other hand, I drive a 1995 Camry that's held together by duct tape, right? That's what comes with the job, but it's okay, I love that car. But let's talk about health. Let's talk about basically what you are about. Health, as defined by the World Health Organization, is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Notice that if you are dealing with a specific exposure, I know this group is interested in asbestos as an exposure, in preventing this, but we're actually talking a bigger picture that you are also involved with. It's not the idea of just preventing asbestosis. It's not the idea of just preventing mesothelioma. That's part of what you're doing. But in essence, you've taken on a bigger cause, and that cause is the idea that there are aspects beyond the physical. It's the social well-being of our population that's important. It's the mental well-being. Now, public health, which is what this uniform is about, right? Officer in the U.S. Public Health Service, Commissioned Corps, sir and ma'am. This man used to be one of our officers in uniform. He remains an officer, not in uniform. As I was telling him earlier, none of our officers retire. Once you're in, you're in. It's like the mafia. You're in forever. And he's just awaiting orders. But he has done incredible things because he has already, in the last decade of activism, has been following those orders, which is what? Our mission is the same as your mission. Today, I do want to bring up the concept that you are now all deputized in our nation's mission. And those of you who come from international realms, think of it as that reach across the oceans to say what? That we are all dedicated to this public health mission. The public health mission is to protect, promote, and advance the health and safety of our nation. For the international world, either put in your nation in that, or let's get really enthusiastic. Let's say what we're doing in an international group such as this is that we're here to protect, promote, and advance the health and safety of the world when it comes to asbestos as a subset of all the world problems that exist out there. And that if we focus on the idea of health being complete physical, social, and mental well-being, that we have now taken on incredible burdens and incredible responsibilities. So in this realm of public health, we deal with, well, let me go back to that slide, because the idea of public health is really the idea of preventing disease, prolonging life, and promoting health. And notice this is where it gets really interesting. And I love this definition because it comes from 1920. Sometimes we think, oh my goodness, how dated that is. Couldn't that Surgeon General have come up with a better definition that's more current? The reality is this fits in perfectly, and specifically fits in perfectly with this group. Because notice, it doesn't say that this is done strictly by the World Health Organization. It doesn't say that this mission is conducted by the federal government or the state or local government. The second part of this definition is just as important as the first part, which basically talks about the idea that this is organized efforts and informed choices of society, organizations, public and private communities, and individuals, which is de facto you all, no matter how you describe yourself. Who are you? What do you do?
My name is Yvonne Waterman from the Netherlands, and I try to spread asbestos awareness over Europe and over the Netherlands and help in the cause.
So by definition, you're a public health worker, right? Exactly, but that's what I want to say. What do you do for a living?
Hi, my name is Cameron Bun St. James. I work in information technology.
IT important, especially in the 21st century, as what? As doing this. So if there's one thing I can tell you today, if you can walk away from this meeting saying that be proud in what you're doing, and you, Chris Weiss, are?
I am Chris Weiss. I work for the National Institutes of Health.
Exactly. But in the midst of all this, whether you're from the Netherlands, whether you're involved in IT, or whether you're with the feds, let's not discount the idea that, first and foremost, to achieve our goals in public health, you know, it's like that old saying, it takes a village. Here it takes those partnerships. Here it takes that activism from the Netherlands in combination with the IT guru, in combination with the Fed, the scientists sitting there to achieve those goals. Long gone are the days where we can say, oh my goodness, this is a federal issue, we'll take charge here. I think the feds have grown up over the years with the idea of saying maybe it's a cop-out, maybe it is a little bit, saying, you know, we're no longer capable of really doing all this. Oh, it's because of fiscal constraints. The reality is, despite fiscal constraints, this always has had to be a partnership. It deals with preventive care rather than curative aspects of health. It deals with population level rather than individual health issues. Core public health functions: assess, monitor the health of communities and populations at risk. So here we talk about surveillance models. Public health also deals with the idea of formulation of public policies, the ability for us to do something bigger about things. And the third aspect, which we won't get into today, is assuring that all populations have access to appropriate and cost-effective care. Read here that we try to endeavor, and I'm not going to ask people's opinions of Affordable Care Act or so, but that's the third component, which is, you know, is it going to work or not? I hope so, because having a nation that had so many underinsured and uninsured individuals is a disgrace. So something has to be done, but we won't get into that third portion. But now let's look at the bigger picture too. I always say that in public health, now that you're all convinced that you are playing a role in public health, the reality is what? Is that if you're in public health and you're a pessimist, it doesn't fit, right? De facto, in public health, we have a sense of optimism. If you're a pessimist, you're not going to last long in the field. And sometimes we do have to look at the big picture, the big approach, because changes in public health never occur overnight. Talk about many of the issues that are here causing an issue for our country, right? Obesity. Am I going to solve obesity issues overnight? No. Smoking. 50 years later, I still have 500,000 people dying every year from smoking-related diseases. If I look at my current smoking rates and say, you know, after 50 years, we've come pretty far. It used to be 43% of my population smoked. It's now 18%. Just give up. Well, give up on what? Current trends show to me that if I continue at current smoking rates, 5.6 million kids, 1 out of every 13 kids now alive under the age of 18, will die prematurely from smoking-related disease. Am I willing to take that on? The answer is no. So the fights continue. But here's the optimism part of it, right? If you look at that longer time span, and in this case, this is MMWR published in 1999 that looked at 100 years of public health achievements. 50 years, 100 years, a generation plus, that's the timeline we have to look at to get those achievements. That doesn't stop us from having the responsibility of trying to make changes now. So I'm not telling Linda, I'm not saying, oh, Linda, give up, because you know it's going to take a long time. No, the reality is Linda needs to continue to push. She needs to be there, that voice in the wilderness that says, we got to do something about asbestos exposure in this country. We have to do something about asbestos exposure internationally. But what I'm telling Linda in the midst of all this is, you then have to turn to you, and you have to turn to you, because what we have is there's going to have to be passing of batons in the midst of this. When we look at the achievements here, I'll use something as innocuous or strange as a public health achievement as motor vehicle safety. Year 1900, we started. How many cars were in the United States in 1900? Not much. And yet, in those 100 years, not only did we develop a brand new technology, and it changed the world. By the 50s and 60s, right, Eisenhower had built the interstate highway system. It was changing the way we transport ourselves. But in the midst of that, not only did a new technology evolve, we noticed, hey, there's some bad things going on here. You know, there's people dying. There's people getting maimed. So let's do something about it. And notice it went from technology development to technology spread to a change in our lives to an awareness of a public health issue to engineering techniques, seatbelts, airbags. And that's what we look at here. Asbestos is here. Right? I look at it, although it's realized that we're in the 21st century now, and asbestos exposure has become an environmental issue. But here, it's under safer workplaces. It's the sense that one of the achievements in that time period was what? You have this incredible fiber-like material that is changing the world. It's changing the shipbuilding world. Oh my goodness, how great. Right? The stuff doesn't burn. It's a good thermal insulant. Let's use it. And yet in the midst of this, you realize, much like the car, that along that pathway, a technology develops. It's put into things. But then there's health ramifications. Then there's reaction. Then there's an ability to push on. And we would like to say that the problem is solved. I would love to say that the problem of asbestos exposure in this country is done, that we will no longer see disease, because that's how good we are in public health. The reality is much like my tobacco issue. 500,000 people a year die from tobacco-related diseases. 20 million people in 50 years lost prematurely because of an exposure like this that we are still learning about and still struggling with. We look at the public health model. It really starts with surveillance. What is the problem? It goes to risk factors. What is the cause of that problem? It goes to prevention, interventions, what works, and then implementation. How can I change the bigger picture? And let me run through just real quickly aspects of this. You know all this already. So public health surveillance. This is systematic collection, analysis, and interpretation of health-related data. It's essential to public health practice. So it's not creating data sets or looking at information just for information's sake. It's not for the IT guy to sort of plug these numbers in and we leave it alone. It's got to be closely integrated with dissemination of that information. Asbestos-related diseases, asbestosis, mesothelioma. It's a problem issue with surveillance. We know, Linda knows very well, all of you know, right? The latency period. The whole issue of being difficult to diagnose, right? That is a problem arena for a disease that if I'm trying to find out what are its ramifications to be able to classify. The diagnostic tools, although there, and many newly developed diagnostic tools, still imprecise. The idea that there's no cure for disease related to this plays a role in terms of how it pops up on surveillance systems. And let me provide various methods used in general for surveillance systems: notifiable diseases, lab specimens, vital records, sentinel surveillance, registries, administrative surveys, other data sources, the internet, for example. When we look at surveillance and mesothelioma, nothing's perfect in terms of a data source, but certainly the SEER data, surveillance epidemiology end results, cancer incidence rates, looks at mesothelioma incidence per 100,000 denoted here, and I'm not asking you to look at the numbers, I'm providing examples of surveillance. Pneumoconiosis deaths, looked at by the National Surveillance System for Pneumoconiosis mortality. Better look at it is looking at the subset that deals with asbestosis as a subset of pneumoconiosis. Those systems exist. We can argue, are they robust? Are they active? How good are they? The reality is, at the end of the day, it proves that I still have a problem in this nation. We know of the individual patients. We know of Michael, who's sitting there. Michael, I send you strength in these times. I wish you were here. But we were talking about you earlier, about your activism, your strength to be a fighter and to bring this issue to the forefront. The Office of the Surgeon General congratulates you on that activism. So we know about all these things, right? But it's also the idea of how we go forward on this. And this is just one study. I don't cite it that this is definitive, but the reality is this problem is not going away, right? One study comes out with saying that, okay, this isn't a 20th century exposure, nor is it a 20th century disease associated with it, nor is it 20th century mortality. This is 21st century stuff, and this has an impact on our nation. That's why the Office of the Surgeon General is interested in this. This has an impact. Projected cases between now and 2050. It's not zero. Far from it. And yet when we do surveillance, what's key and often breaks down, and this is where government funding plays a role, right? It's one thing setting up or utilizing surveillance systems, right? So the IT approach, you know, you can run all those programs, you can put in all the information, but at some point this information has to go to this guy here at NIH. It's got to go to CDC. It's got to go to policymakers. And that's oftentimes where things break down, because at the end of the day, if we are going to have impact, and because, as I told you, public health is not just that interaction with that single patient. That's in the hands of others. Public health is what can we do for the population. These surveillance systems have to be robust and utilizable. We look at risk factors, interventions, what works. You know, fit in asbestosis, fit in mesothelioma. The pathway is quite clear. There's a pre-exposure phase. There's the hazard and agent that you come in contact with. There's the behavior risk factor, right? Sometimes unaware, sometimes associated with work done in the home, right? Sometimes associated with work done in the occupational setting. Sometimes done with a simple thing like hugging a father. Totally unaware. But the reality is that that results in an exposure, a pre-symptomatic phase, apparent disease, and death in some circumstances. And yet in that whole scenario, there are so many aspects that are preventable. Right? This is the hierarchy of control, very familiar to people in environmental and occupational medicine. Is the idea that, yes, we start with the concept. How are we going to affect the population? It's elimination of the exposure. Behind that, substitution. Behind that, using engineering techniques, administrative controls, behavior changes. Notice that personal protective equipment is at the lowest side of this as being the least effective and least sustainable. And yet oftentimes we put the burden on that. Like, we don't have to deal with anything about the exposure. Why? Because, put a friggin' mask on, right? Put gloves, put yourself in the gown, put yourself around, you know, put things around you. And yet we know from an occupational environmental perspective, that's not what we want to tell our nation, our people. That has the least impact and has the most danger. Certainly preventing asbestos exposure. These are the messages we try to get out. This is the message we try to get out in the letter. And I'm proud to tell you, Linda, because of your activism, Vic's persistence, right? This is the third letter in a row coming from the Office of the Surgeon General under, oddly enough, 3 different Surgeon Generals, right? 2 actings, okay, we're just the riffraff. But 1 real Surgeon General, right? But the reality is we do not give up on this messaging. Why? Because we know that there's a message to be given out to the American public that says, number 1, I, as acting Surgeon General of the United States, with all these medals, with all this stuff, think this is important. And I think this is important enough not to sort of say, oh, let's do more studies, let's do that. That I have an obligation, as I took the oath of office, to basically say I protect, advance, and promote the health and safety of our nation. That this is an obligation to get the word out. to get this information into the hands of our population. And final stage, implementation. How do we do? What do we do? What do we change? This really is the formulation of those public policies, right? So we can identify local and national health problems and priorities and do something about them. First and foremost is setting national goals, right? And we look at the idea of using, right, the vision as shown to these immigrants. I'm the son of immigrants to this country, very proud to be American, born and raised in Chicago, but I'm of Ukrainian stock. Parents came here in 1949, post-World War II. You know, they are giddy that their son had the opportunity. And guess what? Even the son is giddy to say, this nation is incredible, right? To get a little kid from the Yuki neighborhood of Chicago into this position, pinch me, Chris Weiss, pinch me. But this vision is really that sense of all that enthusiasm that we have. In this look of the immigrants pointing out there, saying that there's something to be had, we have to maintain that sense of optimism that somewhere out there is the ability for us to affect, whether through legislative pressure, yes, I'll mention that, whether it's through pressure on other decision makers, to use those policies, research agendas, recommendations to attain those public health goals. Healthy People 2020 is the next example I'll use. Not a lot on asbestosis within there. But this is a national priority developed every 10 years, started in 1979, a science-based 10-year national objective. Promotes health, prevents disease, includes a vision, mission, goals, focus areas. Latest version. So every 10 years, the nation says we have to do something about these problems. Latest version launched in December of 2010. These are national goals for 2020, 600 different objectives, 1,300 measures. Each objective has to have a reliable data source, a baseline, and a target. It does include reducing pneumoconiosis deaths in that national perspective. And the reason I want to bring it to this group is the sense is that we use national information like this. Again, a subset of this is asbestosis. But we realize that that substance, you look at the data, right? It's a growing substance, right? Coal worker pneumoconiosis, it's actually been dropping. That's right. Silicosis, some steadiness, perhaps little blips. But a lot of these deaths are asbestos related. Look at the fact that the nation has put this up as a national priority. Utilize that for your purposes, which is citing Healthy People 20, saying you, the feds, working in conjunction with other partners, are actually looking at this. Lung cancer deaths, again, a subset of this are associated with asbestos exposure, right? There is a national imperative to decrease this. Notice that last bullet in particular, the effect of smoking and asbestos exposure. How many of my smoking attributable diseases may in fact be worsened, both from a prognosis perspective, but also just a prevalence or incidence perspective, because of unknown asbestos exposure? What subset of my 480,000 deaths per year, many of them associated with lung cancer, may in fact be worsened by this exposure? And then the role of government in all this. Tom Frieden, the director of CDC, put together a great, and what I want you to do is, these are examples from the article, but fit your world into it. Right? So one of the responsibilities of government in terms of public health action is to promote free and open information to facilitate informed decision making. Okay. How are we getting that information out? Are our partnerships vibrant enough? And here are the examples he uses in that article. This is a great article. Read it. New England Journal of Medicine, May 16, 2013. It talks about the role. But what I want you to do is all of you are asbestos activists, is to figure out where should we be doing more? Because these examples are the straightforward examples, right? The idea that government has a role in terms of making sure that truthful advertising, labeling, drug package inserts, that's information. Next role of government, protecting individuals from harm caused by other people or groups, right? So this is the whole idea of what do we do in government, and how does this fit into the concept of not saying caused by other people or groups, but caused by outside exposures. What are we doing about that? And then finally, taking societal action to protect and promote health. And herein lies the concept, right? Vaccination mandates. The feds don't just say we need to vaccinate people for the sake of, increased income for people who are the vaccinators, increased. The reality is, at the end of the day, it's the concept of taking and bettering that society. And what are we doing in terms of the concept of getting information out? First point, doing something about it. And third point, changing our society, i.e. the bandwagon of elimination, for example. What's being done? You know, I can sit here and say, oh, a lot's being done. The reality is some things are being done. It continues to be somewhat regulated by OSHA and EPA. There's no ban on it in the United States. EPA, NIOSH, ATSDR are the bigger players. The vermiculite mine in Libby, Montana, Chris and Aubrey Miller working a lot with many other partners on that, a biggie. And the idea of having at least some research dollars going into it. But I'll tell you, the truth is research dollars are a hard commodity all across the board now, and that needs to be more inserted. And the reality is the issue of banning. I'll come front and center. There has been some progress. If we look at it, the 20th century, right? 1973, EPA banning it in spray-applied asbestos. You can read the steps along the way. But once again, we get to 89, a final rule issued under TSCA banning most asbestos-containing products. 1990, EPA prohibited spray-on materials containing more than 1%, but by 1991, the Fifth Circuit Court saying, but this is a pathway of regulatory public health. We're running into the same problem right now, and look at your entity and other entities that go through the same issue, right? Right now, again, one of the imperatives of our office has always been smoking. Guess what? We're constantly in battle with the tobacco companies, right, over these issues, right? Tobacco companies were ultimately sued successfully. I know there's been a lack of success to some extent in many of these asbestos lawsuits. But you know, when the lawsuits came out, guess what they caught them on, right? What did the tobacco companies fall on? The charge was what? Well, it was, the term is, it's almost, you know, it's almost more that Elliot Ness term, right? Racketeering. That's what they got him on, racketeering. Basically saying that they were running a racket. They were telling mistruths and untruths. And to this day, it's 2014, lawsuits were settled in 2009 and 2010. We're still working through the regulatory public health is never a simple pathway. So we have banned products under TSCA, Clean Air Act, Consumer Product Safety Act. Yes, there is some effect of all this. And yet here's the list of products not banned. This is an issue, because why? Exposures continue. The nation's doctor says, you know, ain't good. Last thing I'll talk about before our question and answer period, national prevention strategy. And this is something I want to make your group aware of, because the national prevention strategy is embedded. Nobody talks about this, about Affordable Care Act, right? They talk about the insurance exchanges, they talk about the website, et cetera, et cetera. Embedded in those thousands of pages, hundreds of pages of the legislation, the Affordable Care Act, is in fact a re-emphasis on prevention. And this is more so where you and I, Linda, and you and I, Dick, and all of us in this room got a partner, because you are part of this prevention strategy. The vision is working together to improve the health and quality of life for individuals, families, and communities. Notice it starts at the individual level, expands to the community level, by moving the nation from a focus on sickness and disease to one based on prevention and wellness. And you have two burdens on you. You have sick people that you have to advocate for. But at the same time, that's part of your goal. Is prevention and wellness, is to make sure that exposure doesn't occur. That's what we're all about. Within the council itself, 20 different federal agencies. And embedded in this is an interesting approach. So part of our job for the first 6 months after the Affordable Care Act was signed, and this group is chaired by the Surgeon General. So Dr. Benjamin, who is my predecessor as the real Surgeon General, I as acting chair of this group. I have various partners in the room. And part of our initial mission, if you were, was to convince these agencies that you play a role in prevention, right? Department of Transportation, oh, we're not a health agency, we're not. No, you do car safety. You're prevention. Housing and Urban Development, oh, we just, no. You, in fact, control housing units. Aha, ain't that an interesting partnership between groups who are interested in asbestos activism and a group that deals with housing in this nation? EPA is part of it. I mean, this is fascinating for us to be able to have this group with this focus. And the partners in prevention don't include just the feds. prevention strategy that came out in 2011 really says that, once again, whether I'm passing the buck, Dick, to you now in the civilian clothes, or I'm just being a realist that this is too much to handle for any one level, acknowledges that this is the feds, the state, tribal, local governments, businesses and employers are part of this, the healthcare system, education, community, faith-based organization, individuals and families, and the roles that we have in prevention are many. Right? It could be the scientist, it could be the data collector, it could be the policymaker, it can be the consumer. The strategy came out with a focus on increasing the number of Americans who are healthy at every stage of life. You are party to this, Linda. Increasing the percentage of Americans, or the number of Americans who are healthy at every stage of life. You are now part of the National Prevention Strategy. We look at it from the perspective, too, of looking at 4 major influencers. Perhaps for this group, the most important are 2 of these. Actually, all of them are to a large extent, right? So put in the asbestos model into this. Healthy and safe community environments. That's asbestos written all over it. Clinical community preventive services. It's asbestos. Empowered people. Health literacy. The concept of being informed. It's asbestos. Elimination of health disparities. That's asbestos. You're here. So, in this last half hour or so, and occasionally I get to be a little long-winded, but I hope this met your expectations, which is going through what public health and its role has in the issue so near and dear to you, to acknowledge that the issue is near and dear to the Office of the Surgeon General. The idea that we're here to work together on making this nation better. It does take a village, it does take this partnership, it takes the realization that things are not going to change overnight. But every success, every single acknowledgement, whether it's what's in control, in my control, which is another letter that we'll dedicate ourselves to bringing this up as an issue, which is serving as much as we can within the federal government as an advocate for a public health issue. That's what we bring to the table. But once again, it's you and what you do. Today, the most refreshing thing was Linda was introducing me to the interns who are around, right? That's the next generation. And I would say in leadership position, the reality is we would like to say that we all can do this ourselves. But once again, the emphasis is that we always have to be out there with the idea that we are constantly training our successors. Because once again, in public health, things won't change overnight. But if we look at the big picture, they will change. I am confident. Why? Because I told you earlier, in public health, got to be optimist or else it'll drive you crazy. Thank you so much for your attention today. Thank you so much. I was going to suggest you get up to stretch a little bit because the Surgeon General is also into physical fitness and moving around. So, but I do appreciate your accolades. Thank you.
I think you can all see that right now, at least, our nation is in good hands with the doctor we have heading our country. And I'm going to put him on the spot, but I think he's agreed to take a few questions. So before we have presentations, let's take a few questions from anyone that has anything for our Surgeon General.
Good morning. Great presentation. My name is Kermit Piano. I'm from Canada, from the Ontario Building Trades. We represent 200,000 unionized construction workers. Unfortunately, far too often, our workers are diagnosed with all 4 types of asbestos-related disease, especially mesothelioma. Question I have for you, you put up a slide a couple of minutes ago. You had all the different government departments that are going to work in ancillary to each other to prevent this. One thing I didn't notice, and we have the same problem in Canada, is the departments that are charged with negotiating all these trade agreements internationally. Shouldn't there be some type of language on the importing of any carcinogenic materials, especially asbestos. That's number one. And number two, I'm always shocked that in North America, such a sophisticated society, in government procurement agreements, being at the federal, state, and local level, that there isn't any language in those deals that prevent asbestos materials, like you put it in like cement board, cement piping. What do you think of having those partners help us in this idea of preventing asbestos?
Yeah, and without a doubt, those are two key features that, you know, show you how, to a large extent, we make some headway and yet realize that there's gaps to be filled. So again, from an optimistic point of view, regarding your second thing, regarding government contracts, we have GSA, Government Services Administration, involved in our National Prevention Council. Am I on the cusp of having them change their ways? The reality is we're making an impact. But the problem that I've seen all along, and this maybe is our bad in public health, you know, and I'd like to maybe get some feedback from people, is that to a large extent, we've kind of separated ourselves out from the general community, right? We've said, this is an occupational health issue. We in occupational health need to deal with this. This is a public health issue. We in public health issue. People need to deal with this. And what I'm seeing is, because of this National Prevention Council concept, is the ability to extend that partnership. Because the whole concept really is, you know, whether it's the whole idea of procurement and contracting, I need to have the contracting people realize there's health ramifications in what they're doing. And it's not that they're necessarily malicious. What they're doing is they may be unaware of many of these issues. From a trade perspective as well, trade is big bucks, right? Trade is the interreactions between, you know, between national agencies across the realm. But, you know, once again, the goal needs to be to make sure that the trade people understand that there's things going on out there that are bad for trade. One of the recent things is not dealing with asbestos, but dealing with tobacco is I still have a major issue in terms of tobacco trade, right? And we make some headway. There's a new Trans-Pacific partnership that is being signed right now where we got some language to actually start talking about carcinogens and specifically tobacco in that trade. Does that mean that it stops the trade? No. But the best I can do at this point is to make it a conversation piece. So the idea is absolutely right, that there are so many different pathways that we can take and where we have to extend that partnership of saying, no, what you're dealing with is a health issue. And so therefore, I need to be able to teach you, to bring you up to speed, and to be able to give you that recommendation of what to do and what not to do. That's correct. But it's very frustrating, without a doubt.
Do we have any other questions?
Hi, thank you. You have a tough road to hoe just getting to the point where you get on top of the asbestos issue as it's defined.
Paul, would you identify yourself so he knows who he's talking to?
Paul Zilbon. I have Mesothelioma. I've been fighting for 16 years, and I'm an advocate in the area. I'm also a professional in technologies, and I started in the medical aspects. But my question is, asbestos is a very complicated matter just from the standpoint of definition. And I wonder if you have a vision of how the Surgeon General's office might be involved in later years. Let's suppose that we finally win and we have a ban on trade in asbestos in the United States, which I think we still don't have the mechanism for doing, but I think we'll get there. Still, we have in front of us the issue of forms of asbestos that are not legally asbestos, asbestiform minerals that are defined as asbestos, short fibers that are not defined as asbestos. And we have asbestos present in products that are there as a contaminant metallic that's used in the manufacture or things like that. Do you see a role for the Surgeon General's office in terms of expanding those definitions?
Well, I do. And again, you know, I'll go back to sort of the job of the Surgeon General. You take the best science available, hopefully the best science, evidence-based, right, and communicate it or translate it to the American public. So first and foremost, I'll tell you right now, I don't have a research budget, right? So we're not the researchers of all this, right? That's in the hands of groups like NIH, NIEHS, that's represented here, right? The research side of the house, so to speak. But what I have is the ability to communicate using that term. And so the idea is here that, in essence, I rely on my partners. And that partnership really does include the whole universe that I showed you here, right? I just don't talk with NIH saying, give me the latest on this. What we do is We have a forum. We have the ability to say, talk to me about what's out there, and are we ready to go with messaging, right? And to a large extent, you know, part of the issue and part of the bane of asbestos-related diseases is what? Case definition of the disease itself, and also recognition of the exposure. And both those things, without a doubt, we're behind the curve on both. But the reality is we have the capabilities to get messages out about those things. And that's the best I can promise at this point. But again, evidence-based, and the more we get information from partners like Chris Weiss, right, who says, hey, listen, Surgeon General, there's something we should be working together on. You know, the reality is, you know, and this is very interesting, because, you know, now that I've been in this office for 4 years, you know, once again, we have a limited staff. We have limited funding. I'm not here bringing my hat out and saying, give me money. Although, as I had mentioned earlier, what we do on Saturdays, usually it's good we're already dressed up, is Lieutenant Chica and I will actually be carrying bags and parking cars here at the hotel, because we make more in tips. And we use it for our office. It's not personal benefits, so it's all above board. But going back to this concept is that what we offer is partnerships. And what we do is we turn to people like Chris Weiss and say, hey, Chris, you got an issue? Chris, you want to work the asbestos issue? Guess what? Chances are you and your team are going to do all the work. Chances are you and your people are going to pay all the money. But we have a branding. We have the ability to take that issue and say, let's do a call to action on asbestos. Let's do a Surgeon General's report on asbestos. There's a partnership that exists there, but to a large extent, that's what our capability is.
We'll take one last question. Barry?
Hi, I work with people in other countries about asbestos problems in public health workers. And you mentioned that your family came from Ukraine. Gives me reason to ask. The United States is talking about providing assistance to the government in Ukraine right now, financial assistance. And Ukraine has been in the position of being little brother of Russia and getting knocked around very badly on the issue of asbestos. Their per capita consumption of asbestos is the highest in the world, at least among the top 5 countries. And they were used as a staging ground for a bogus so-called scientific conference in 2012 in Kiev that was used as a basis for Ukraine, or rather for generating a so-called scientific basis for opposing the inclusion of asbestos under the Rotterdam Convention for prior informed consent in international trade of toxic materials. And so, is it possible that you might be able to have some influence on the administration in saying part of our assistance to Ukraine is provided with the expectation that you're going to do something to raise public awareness in your country about the lethality of asbestos and start a serious program of not just being used by the Russians as a place to sell and use asbestos under uncontrolled conditions and talk about how somehow that's acceptable.
Right, and you know, I'm a realist, so I hear what you're saying. Realistically, do I see a tie-in with aid packages going to Ukraine and some sense of whether it's an asbestos issue or other public health issues tied in? 0% chance of that. And let me tell you, because right now it's a very reactionary environment and one that is full speed ahead. On the other hand, I do have optimism when it comes to that issue, asbestos use in an international environment. You know, Ukraine is filled with public health problems. The reality is that the new Minister of Health there in Ukraine we have a CDC person stationed in Ukraine. So we have direct connectivity, happens to be a close friend of mine who wrote me last week saying that the new Minister of Health there is a breath of fresh air, okay? And that's the concept. Is tied in with economic packages? Probably not. Tied in with the idea that if this fledgling country, even after 20 years of independence, much like many other countries, in fact, is put into the right hands, we have the ability to influence from a public health perspective, because we have great people on the ground who represent the Centers for Disease Control. He's an officer in the U.S. Public Health Service. He now says we have a better connectivity we ever had, and that's my optimism, right, is the idea that as things change in a country such as Ukraine, that we can push ahead and bring to a head a lot of those public health issues. Because, you know, unfortunately, asbestosis and asbestos exposure is but part of the list. right? The issue of HIV/AIDS in Ukraine is overwhelming. The issue of smoking in Ukraine, of alcoholism in Ukraine. But we have that ability, right, if things move in the correct direction.
Thank you very much, and I'll turn it over to Linda and Doug.
On behalf of our entire organization, we have felt your words. We are a partner with you, and I want every person in this room to promise us and the Admiral that his statement that was just issued this week will be shared with 10 people, and ask those 10 people to share again. And let's continue the prevention that you began just this week with your statement. ADAO would like to present you with 2 gifts. Dr. Lemon, we're going to go on stage. Oh, come on, Richard. Quick.
He thought he was off duty already.
We'd really like to have a photo op with everybody here, but I know you understand that the Surgeon General is going to another event, so we are going to present 2 special gifts to you and use this photo op as an opportunity to share with those who are not here. Richard, would you like to present this one, please?
On behalf of the Asbestos Disease Awareness Organization, and thank you for holding the mic, that's a good job, we would like to present with you a small token of our recognition and thanks for all you do and for coming and taking a Saturday morning to come talk to ADAO. Thank you very much.
Steve McQueen was probably one of your favorite actors, although you probably can't endorse one actor. But his widow, Barbara McQueen, has stood behind ADAO. She has put in a page about mesothelioma. This book has traveled around the world, and it is appropriate that America's first doctor has this book to remember us by. And we thank you. This is from Barbara McQueen.
Great. Great, and once again, thank you for your hospitality. Thank you for this forum. I will be around for about 5 or 10 minutes outside, so if you want to talk about issues, questions, etc., we'll be happy to do that. But, you know, it goes back to what Linda just said, and I believe in this wholeheartedly, although I've been, you know, bothering Lieutenant Chica, as you know, as we entered our first speaking engagement earlier today at about 0700, that's 7 o'clock. You know, and I'm thinking to myself, what am I doing on a Saturday? And I was kind of giving her grief, saying, you know, you people scheduling all this on a Saturday, you know, I've been traveling a lot, we've been doing, but in reality this is what it's about, right? It's the idea of the connectivity we have, the ability for us and the Office of the Surgeon General, as I keep saying, we're blessed with this opportunity to be able to at least have this connectivity. The first talk I gave this morning was on with a women's health conference in town. Now I'm here with the asbestos, interests at stake. And the reality of this position is this is exactly what they pay us to do, right? Is the ability to advocate for public health, to be able to support those who are out there fighting the fight. And once again, our ultimate goal is to protect, promote, and advance the health and safety of our nation. And this is one of the ways we can accomplish that. Thank you.
Thank you.